Good evening, everyone, and welcome. My name is Jayesh Kapitan. I'm a partner with RSM, and we are partnered today with Macquarie. Before we get started, I'd like to just take a moment and acknowledge the traditional custodians of the lands on the various lands on which we gather today. I'm joining you from the lands of the Wurundjeri Woi-wurrung people. We'd like to acknowledge their enduring connection to the land, the water, the sky, and their culture. We pay our respects to the elders past, present, and emerging, and any Aboriginal and Torres Strait Islander people who are with us today. We thank them for their generosity and their hospitality in sharing their lands with us. Thanks, everyone. And I might just do a quick introduction. We've got a few presenters here this evening. We've got Caitlyn from Macquarie Bank. She's a senior business development manager, recently joined in May, and has got a particular focus on health and the education space. She's passionate about working in the health industry, and just before we started the session was telling us about previous experiences and working with some of our clients in past lives. Also has experience with Bank of Queensland and ANZ. I've got Luca Catelli with us from Macquarie as well. Luca's a senior business development manager in the health, education, and community space. Has over 10 years of experience and has also had past experience within the CBA and Westpac organizations. I'm cutting them a bit shorter because I'm sure everybody wants to get on with the good stuff. And finally, we've got Arlene Kristianto. Arlene's a partner and director within our practice in RSM, based in Sydney in our business advisory division, has over 22 years of experience within the accounting sector, assisting high net wealth individuals as well as medical practices, GP specialists, surgeons, and small to medium medical practices. There's a number of topics that Arlene will touch on, which is her areas of expertise, including tax compliance, business planning, budgeting, cash flow projections, and practice health checks. Just a little bit about me. I'm a partner within the practice, and I'm the national lead for health services at RSM. Over 25 years of experience, and I focus on risk advisory practices and focus mainly on the hospital side of things. But today's topic is extremely important because the GP practices and medical specialists provide a very critical role within the health sector and in the wider spectrum, making sure people are getting the care that they need in the first instance and trying to keep as many people out of hospital for as long as they can. So I think it's a very, very important part that everyone plays. So on that note, I will hand over to Arlene to commence today's presentation.
Thanks, Jayesh. I'm just going to start with this first, and if you guys can let me know, you can see my screen with the slides just fine. I can only see Jayesh, so thumbs up. Okay, excellent. Thank you. Good afternoon, and thank you for joining us tonight and carving out some time out of your very busy day. Trust the next hour will provide some insights, some food for thought, and also hopefully spur you into some action in terms of growing your practices. What I will cover today. This is kind of like a high level. I will kind of weave in and out of them because I think they're very interconnected in terms of what we're going to be talking about. But I just want to cover off, what does growing your practice look like? Because I think it does look like for different people depending on where they are at the moment. I'm gonna focus a bit more on understanding and optimizing your current practice and using what you have at the moment and essentially utilizing the data that you have, maximizing that to its full potential. And then I'll show a little bit of what that actually looks like with some of our clients, what does the reporting and the dashboarding looks like, and how we actually use it when we're talking to our clients. And then really the last step is just where do you go from here? What steps can you take out of the following from this session? One thing I will mention as well, if you guys have any Q&A, if you can put it in the Q&A box. Jayesh will help us monitor that. So and then yeah, as appropriate, he'll ask those questions and potentially at the end of the section, those questions will be asked as well. So don't hesitate. Just put your questions in there if there's anything that you wanted to know more about. So I'll just start off with, I probably don't need to tell anybody in this room about this, but it's a very interesting dynamic and sometimes dilemma really, because as a health practitioner, on the one hand, obviously the main focus is about your patients, is caring about your patients, making sure that they are their needs are being met. You are consulting with them in the length that is appropriate to improve their health outcomes, really. And the more affordable care that you can provide, that people can access, that's really the goal. But sometimes that can mean, that comes at the expense of your work-life balance, just because some of these things takes a lot of time. You plan on seeing them for a short-term consult. It might end up being a longer-term consult. That's one conundrum. And on the other hand, as a good practice owner, you also need to balance the need of the practice, where on a business perspective, we need to make sure that there is enough revenue in the practice to cover rising costs. We all know about high cost of living, but also wage costs and other costs in the business are also increasing. And that might mean that the health practitioners need to see a certain number of patients every day. And that's kind of where the time crunch becomes, you want to see a certain number of patients per day, but then some might take longer than others. And throughout all of that, you want to make sure everything happens as efficiently as possible. The resources that you have, and that could be a consultation room, and that could be your nurses, your admin staff, your receptionists, that they are being efficient, but you still maintaining their morale while they're helping you running the practice, and they are used to their full capacity. So this is a very common conundrum that we see when we talk to our clients. So it's anything that can help with this dynamic and this pool really would, I think, help a lot of practices. And on that note, I think you guys have a lot of data in your hands that can actually lighten the load. It's not nobody's saying it's an easy process. It's complex and it's a very demanding job, and it's exhausting at times. But I think using the right information that you have in the practice can actually help make the right decision to ensure that the resources that you have at hand are being properly allocated. And that might sound really economics, and I certainly remember back from my economics days at uni, it's a proper allocation of resources, but it certainly is true if we want to make sure that the practice that we have are sustainable. And actually, a lot of it is being made possible because these days a lot of things are digitalized, and what comes out of that is the amount of data that you have access to, and some of the things that you see on the screen there. They're things that have already been happening for a long time. You're booking online, and patients can do all of that automatically from their phone. So making sure that your practice is geared towards that as well obviously helps with the efficiency, because then you don't need to necessarily have the number of people managing all of that. And I'm sure a lot of practices are already doing that, but I think the next step is towards the bottom there, where there's other things as well that can be done automatically, digitally. And again, what that means is that you've got all these data at the tip of your hands, and then the question is, how do you use it to the best advantage, really? So what that generally means is there's no shortage of data. There's an overwhelming amount of it. And are you using it to optimize how your practice is run? And how the data can be used is really, it provides a lot of insights about patient care. You can look at the patients that you've that have been seen in consultations the last 7 days, last month. You can identify some of these patients that might be at a particular demographic, or maybe particular, if they've got chronic diseases and whatnot, and you need to make sure there's follow-up, there's regular reviews. So there's data that can be used as well to identify and minimize clinical risk when you're only relying on people. It shows trends as well that can help with staffing levels. And a lot of the times, when we're running our practices, we might feel, I know that the busy period, for example, is a Wednesday. So I'm going to make sure I staff my nurses and my receptionists, my admin staff on Wednesday. But there's actually information through all the different touch points for the patients, for the staff, where you can actually know for sure, instead of just relying on gut feel, that it is Wednesday, but actually maybe it's also Thursday afternoon and Friday morning for whatever reason. But those trends can actually then help you make a decision of, well, now I need to make sure I have enough staff on those days to make sure that there is enough receptionists or there's enough nurses so that there's less times on patient. Everything is running efficiently. And at the end of that process as well, is that having a look at the financial aspects of how the practice has been run. What are the revenue that the practice is generating? Is there anything that we might be missing? What kind of things should we be looking at? And all of that, when you start looking or drilling down into what is actually happening right now, it actually will help you to plan for the future. And whether it's just in the current practice, or if you're looking into expanding further into other location. So really I guess the key thing is that as practice owners, it would be very powerful to understand how to interrogate the data that you have, understand what is actually telling you, and determine then what step can I take next. And it's not always, if I don't do this, then it's going to be dire situation, but it's also taking opportunities as they arise. I'll go through in some of these in a bit more detail. So the question that I would pose is that if you're positioning yourself to grow the practice, then what should you be focused on right now to set yourself up for success? I do want to step back a little bit though, and when we say growing the practice, what is your growth strategy? I mentioned earlier that it could mean different things for different practitioners, depending on where you are in your journey. It might be that at the moment you're a consultant health practitioner and you're looking to acquire a practice room as part of your overall strategy in building your practice, building your wealth going forward. Or maybe you already have a practice room and you want to acquire multiple practice room. Or potentially you have a practice at the moment already, a medical center, but a lot of the decisions that are being made right now is based on past experience, but there hasn't been any sort of real drill down into the data that you have. And maybe part of it is also utilizing those practice rooms that you have in the center. It might be full most of the time, but maybe it's not being fully utilized. What else can we do to maximize the utilization of those rooms? Also, potentially, it could be that you have one site at the moment, or one medical center, or one practice, and you want to look at expanding to another area, another location. It could mean lots of different things. All I'm saying is that I think if we drill down into what is your practice telling you right now, and having a look at some of those key points, it will set yourself up for good success in the future. And in all of this, I've been kind of talking about the strategy, but as part of that strategy, and no matter which one you choose out of that, and there could be even more options, what's important is also having the right structure. I wouldn't be doing my job well as a tax advisor if I don't also mention that having the right structure that is tax efficient, but also makes sense from a commercial perspective is really important. And I'm sure that's something that Luca will probably mention as well in his presentation, in that having the right structure tends to also then help in financing and in getting through application and all of that. And it really, at the end of the day, is the efficiency of it. And you don't want to set up something that is not going to work if it's only going to work for one thing but not for others. So you want the flexibility as well. So just make sure you also consider about the right structure for the practice. So just a little bit more on kind of understanding and optimizing your practice. I've mentioned a couple of these things before, so I won't go through them in too much detail. But regular review of the data can really help you understand your position. And if I take the good old saying, if you can't measure it, then you can't manage it. That's certainly one of the things that we try and always talk to our clients about. For example, with the data that you would have a good indication of your patient demographic. For example, is it a young or elderly population? Are your staff trained appropriately or have the right skill set to deal with these demographics? I mentioned before as well about clinical trends and preventative healthcare. You can really drill down into the information that you have from your practice management software. Which patients are due for their health assessment because it's been 12 months, or which ones have been sent to pathology and the results come back, and what follow-ups have been done on that. I think a lot of that is actually managing the clinical risk as well for the health practitioners as well as the practice themselves. I mentioned before about the staffing trends and having nurses and reception staff rostered when they're required, for example, so they are fully utilized. And then also the billing and revenue trends. Are there any revenue misses? If I go back to that health assessment, if we do an analysis of, well, how many patients do we have that are over a certain age, for example, and I'll show you some of the examples as well later on in kind of visually. Let's say you have 1,000 patients that are over a certain age due for health assessment, but really only 200 of them have done it in the last 12 months. There's some opportunities there that can be taken up, again, both from a clinical perspective, but then also that helps the practice as well. You can drill down to, each practitioners, how are they balancing the patient care? How are they billing? If you've got multiple rooms in the practice, and some of them are available for part of the week, it'll be good to understand how much are they being utilized, both from a recruitment perspective, because then if there's going to be a doctor that comes in on a part-time basis, you can start matching that together. Or maybe if that's not going to work, maybe we should sublet some of those rooms. And from a financial perspective, again, mentioned it before, we've got to make sure that the income is keeping up with the rising costs. So having a review of your operational cost is very crucial as well, because some of the fixed costs, as the name suggests, it's fixed. You can't change it no matter how many patients you see or how many billings are being done. So you've got to make sure that covers it. The financing costs and interest debt cover ratio, that might be very important as well, especially if you've got debt attached to the practice. And the staffing cost and wage ratio benchmarking is always it's always good to understand whether am I utilizing my staff correctly? Am I actually at market with wages and all of that? And just one other thing with billing them, I've seen cases as well where patient might be seen, but we actually haven't billed them. So even something simple like that, when you drill down to the data, that's something that actually a low-hanging fruit. So understanding the practice data will provide the insights on the individual levers that sit behind the performance measure, and it helps to understand why is the particular indicator important. You can identify particular trends and then identify what can be improved. And finally, it allows you to determine what lever to pull when something is not performing as you would expect. So it really will provide you with information so that you can make the decision to move forward. And if you're looking at a certain project, as we said before, if the strategy is, let's say, for example, to acquire another location or another site, then you've got the data out of your current practice, and you can extrapolate that, make some assumptions, but then you can create forecasts on what the cash flow might look like based on that particular demographic, on profitability, and a lot of it then can be also assessed at the end of well, not so much at the end, but as you continue with the project, you can measure whether is this also turning out the way I'm expecting it to, and if it's not, you can anticipate these issues in real time, so then you can make a change before it goes on for too long, which then makes it even harder. And a lot of that can be done through tools, analytical tools, and having dashboards and visual analytics, I find is really useful, because when you can see it, it actually helps. It helps. It helps you kind of look at it, and potentially also then makes it easier to address what needs to be done. So some of the things I will share, and just mindful that this is some of these are data that have been extracted, so I've made it all unidentifiable, but just to kind of illustrate what we can do, we are using some of these online dashboards that can sit on top of a lot of your system. So for example, your practice manager can extract data out of your practice management software from best practice, medical director. It also sucks up information out of your accounting software, Xero, for example. So it can also report on multiple location, and then you can compare location. You can have a consolidated group. So there's a lot of things that we can chop and change and kind of just flex. So just kind of give you guys an idea how we normally use this. For example, if we've got a if we want to interrogate how are the patient attendances over the last few years, and you can see with this one, for example, it's actually increased in the last 5 years. But when you look at the revenue, the practice gross revenue, it did increase from 17 to 18, but it kind of stabilized and then decreases in 2021. That alone would create, or would instigate some question as to, well, why is that? And maybe we go down the path of maybe we need to have a look at what are the GP's average patient billing every month? And if there's a trend there, why would that be the case? What's happened in August 2021, for example? And then you keep drilling into the information, and then potentially it's because, well, telehealth actually went up, but yet the Medicare billing for telehealth is a lot less than face-to-face consults. So maybe that is one reason why. And then you can decide, do we need to do something about that, or we're okay with that? So it's just different things that it's telling you about how the practice is currently going. And then it's a decision afterwards that you make as to, well, where do you want to take the practice to? The other thing that I will just share very quickly as well, but just mindful of time, this is what I was referring to before. I know some of these KPIs are geared towards the GPs. They're just examples that I do have. This one is actually data on there's 1,370 patients over the age of 74, but only 234 of them actually had a health assessment in the last 12 months. So there's a significant number of patients who are eligible and due for a 707 or a 705. And this is the drill down on chronic disease management, for example, which is a lot of the times these patients are obviously at higher risk. So from a clinical perspective, they should be reviewed regularly. maybe they're kind of 10 or they're unable to use technology. So it's important to actually monitor those as well. If we do a similar exercise with this particular one, there was actually 3,000 patients, and yet only 1,600 of it have been invoiced with those Medicare codes. So again, it's a question of, well, how do we then manage that clinical risk? You can drill down, which I don't have it here because it'll have doctors' names. You can drill down by doctor, and understand their billing history, their billing behavior. And again, that will give you a lot of insight as to what their practices are like. And obviously on the financial side, you can have a target GP. What is the actually saying? What do we do about that? So all these dashboards can be tailored to what is important to your business and what do you want to monitor at the time, every month for the next 12 months, and you continue monitoring that regularly, and use it to improve your practice. So where to from here? What I tend to say to our clients is that be curious and create a culture that values and seeks out data-driven insights, so you can identify and prioritize strategic initiatives. A lot of it is also to improve your risk management, clinical and financial. Implement a reliable dashboard that can give you real-time relevant KPIs and you can see it. I think a lot of the times having something visual really helps. But really at the other end of it is we need to make sure that we actually understand what we're looking at. We know how to interrogate it. What is it actually telling us? How do we then change the different levers? And then make sure that you do have those regular reviews and regular monitoring, because otherwise, time might get away from us. But I think, as I mentioned before earlier, I think the role of data is actually to lighten the load, not to add another thing to your day that you have to do. Really, a lot of these things should be able to extract it from what you already have, and then once it's set up to the KPIs that are important to you, you can very easily review it, make a decision based on real information and quality information. And again, I'm not going to forget about this one. Have a look at your current business structure, because whatever you are going to decide to do, having the right structure is very important. And I know there's a lot of discussions. It was a very hot topic at the moment in the medical space. Have a look at the agreement with your practitioners. Have a look at the structure, and make sure that any risk that you can mitigate as much as possible, that is being addressed. That is just a little bit about RSM Australia. We're actually across 32 offices around the country. So no matter where you are, we would have someone who can help you in the medical space. And I thought I'll just share my contact details, Jayesh's contact details, and also Lauren and I work a lot in this space, and she gets involved in a lot of the health conferences and getting out there, meeting people, contacts medicos as well. You'll be most likely be talking to either of us. On that note, I might hand across to Luca, but Jayesh, was there any questions in particular that you want me to address right now?
Not yet, so maybe over to Luca and Caitlyn.
Wonderful. Thank you all. Luca, over to
you. Thank you, Arlene. Thank you, Arlene. And again, thank you very much, Jayesh, for the warm introduction. So just to reiterate what Jayesh spoke about earlier, my name is Luca Catelli, and I'm a Senior Business Development Manager working within Macquarie's healthcare, education, and community sectors. I've been at Macquarie for over 10 years, and I've worked with many SME businesses across many fee-for-service industries. I have a deep passion for working within the healthcare space. I'm also joined by my colleague, Caitlyn Tag, as well.
Yep.
And we'll talk a bit about, obviously, the presentation detail.
Indeed. Although I am listed as Luca as well, unfortunately, with the last minute tech issue.
So let's go through to the presentation. So before we start, the presentation details surrounding Macquarie's target presence within healthcare and also the 2 case studies, I'd like to talk a bit about Macquarie's background and who we are. So next slide, please. The Macquarie Group is a global financial services group that employs more than 20,000 staff across 34 different markets and was founded in Australia in 1969. So within Macquarie Group, there's 4 distinct groups. Firstly, the first big group is Macquarie Asset Management, also known as MAM. It's a global asset manager that manages institutions, pension funds, governments, and individuals, and currently manages more than $871 billion in assets globally. The second major division is known as Commodities and Global Markets, also known as CGM, and it offers risk management, lending and financing, market access, fiscal execution and logistics across the metals, agriculture sectors globally. The third major division is Macquarie Capital, known as MacCap. It provides corporate advisory, development and investment in infrastructure and energy and projects, brokerage services across green energy, real estate, healthcare and government services, to name a few. And the most important part of Macquarie is BFS, Banking and Financial Services. That's where Caitlyn and I sit. So BFS is made up of 3 distinct groups. The first group being personal banking, where they house all your individual home loans, credit cards, and also they do leasing for both personal and businesses. And also the second other distinct group is known as wealth management. So wealth management have private bankers who on the ground provide a lot of wealth advice and financial planning to high net worth individuals and also businesses as well. You might have heard of Macquarie's RAP platform. That's housed within wealth management. And lastly, within banking and financial services, you've got business banking. Again, that's where Caitlyn and I sit within BFS. And business banking provides services to approximately 11 fee-for-service industries made up of property services, professional services, commercial property finance, and business services. And under business services, that's where healthcare is sitting. And in addition to the 11 fee-for-service industries, we also have a commercial broker team who provide a lot of help in the broking world, clients who want some commercial and business lending. And lastly, we also have a middle markets team who provide structuring and financing to your emerging corporates and your corporate companies. That's a bit about Macquarie. Next slide, please. One more slide, please. Thank you. So just a bit of information in relation to Macquarie Bank and where we play in healthcare. So you can see on this slide, on the left-hand column, you can see the subsections of healthcare. So we play within the fellow specialist space across many different modalities. So hospitals, diagnostic clinics, veterinary clinics, GP practices, and also we get into dentistry as well. So where Caitlyn and I sit within business banking, it's within a tier 4 and tier 3 spaces. So we'll start with the tier 4 space to start with. So they're more your smaller, customers that are less than $3 million in turnover approximately. Simply your single site operators, your sole practitioners, who looking to fund a mixture of commercial and business lending, equipped with any of the personal requirements. Then we go to the next tier, which is tier 3, and that's where we see multi-site operators. So your veterinary clinics that have more than 2 practices, your GP clinics. In our case studies, post these slides, we'll be talking about 2 case studies. One is a veterinary clinic which has 2 sites, and the second case study will be a 2-site GP practice. So where we play is growth-minded businesses that are looking to expand operations. And with those 6 subsections, we also have released a report, Perspective on Healthcare, which Caitlyn and I and the team will have to share with the audience in the future. And what that talks to is there's a saleable and scalable opportunity to look at, healthcare professionals who want to group together and band together where there's multiple income sources across a number of potential specialists, or there could be a mix of healthcare professionals working within a business where there's an intrinsic value there that we can extract and assist them on their growth journey.
I think
we'll talk about how we land, in the post slides.
Yeah, I think, Luca, this is a really important part, as you say, sort of in this health industry, right? There's a lot of access to funds within health, but as people sort of get to this more scalable piece where their businesses grow, we find that the access to funding and the understanding to the underlying business value tends to decrease. Which I think, Macquarie has a really good grip and understanding behind that. And really, we look to grow with businesses, and we sort of have that piece where you mentioned our middle markets team, where we're able to support people who are sort of starting off in that journey with those smaller style lens. But we kind of go up that curve, and it's all within Macquarie in the same business unit. We all sit accessibly in the same floors, and so we have that piece, that ability to grow with our clients, like you mentioned, and I think it's something from my experience that I haven't seen done well, and I think it's something that we do really well and we want to do with our clients when they get to these next phases.
That's correct, Caitlyn. So you can see on that triangle there, on the pyramid, the tier 2 is housed, with our clients in emerging corporate and corporate spaces, typically around greater than $50 million in turnover, and typically lend north of $30-40 million. And then tier 1 would be obviously, again, your Macquarie Capitals of the world. I've touched on earlier, they do a lot of corporate group advisory services and M&As, and they've done a lot of IPOs, initial public offerings, to assist your large institutional clients. Some of those clients are your Ramsay Health Care of the world and your Sonic Health Pluses of the world, just to provide some context in terms of who their clients are.
And I think that's a really
next slide.
Another really important point is that ability to grow with, but then Macquarie's overview, we have that Mac Cap side that's able to provide, when our clients get to that piece and then the succession and the exit comes in, we have that access to support clients like you've mentioned.
Yeah, and to Katie's point, we do everything from fellow specialists to floating a business. So it's all housed within Macquarie Group, which is fantastic. So there's one touch point, which is great for our clients. Now to the case studies, the exciting part of the presentation. So we've rebranded this business as VetX. These are real life case studies that we've settled loans for over the past number of years. So VetX is a 2-site veterinary business that are located in Sydney. Sponsor A was original veterinarian who set up the business back in 2006, and Site B was established in 2019 between the original owner and one of his employees, which were the group's number one income generator. So what Sponsor A smartly did was lock in Sponsor B and funded succession planning for himself and the business going forward. So what the main purpose of this transaction was to fund a new property acquisition known as Site B, and both Sponsor A and Sponsor B owned the property at 50% each. We also refinanced all of the Sponsor A's property lending and operating company lending loans as well. Total loans equated to $8,286,000. And we'll talk more about that in detail with the next slides, please. So with this org structure, quite simply, it talks a bit about the flow of funds. So Sponsor A is on top, and Sponsor A receives income through a few different sources. So you can see that Propco A, which is known as Property Company A, it's owned between Sponsor A and spouse. Half of the rents go to Sponsor A. Sponsor A also owns the original operating business that was established in 2006. So 100% of the profits flow into Sponsor A's coffers. Propco B, Property Company B, was acquired in 2019 between Sponsor A and Sponsor B. So half of the rents flow into Sponsor A as well. Now with OpCo B, which is abbreviated as operating company B, or the second site, half of the profits going to discretionary trust owned by sponsor A and sponsor B. So that paints a bit of a picture in terms of you know, the flow of funds across sponsor A and sponsor B. Next slide, please. So with this slide, this talks about the loan table. So effectively what we did here was we actually funded a 5.5 mil purchase of a property in Sydney. And what we did was we leveraged against a property at 67%. And what we also did was we also encumbered the operating company 1 and 2, known as A and B, as part of the security mix to get the LVR down to a lower position, which made our risk team a lot more comfortable. What we did was we provided loans totaling $5.8 million, which included a stamp duty. So you can see loan 1, 2, and 3 represents the $5.8 million requirement to settle the transaction. So we did 100% of the purchase plus stamps. And what we did was, you can see that the structure, you know, 5-year loan terms, own occupied premises, interest only. There was a first ranking mortgage over the property 1 and 2. There was also a first ranking charge over operating company A and operating company B, and also corporate guarantees and limited guarantees by the respective shareholders. What we also did as part of this mix, you can see on loan 3, 4, and 5, we actually leveraged against existing property, I know site A, the first original site that was acquired by sponsor A post establishment of the business in 2006. So we effectively leveraged against that asset also at 67%. And we also encumbered a first ranking charge as well over the operating company A. So the 2.1 mil and the $77,000 loan equates to $2.9 million, which effectively is a 5.8 collectively. Loan 4 and loan 5 are purely refinances. So we again leveraged against the property and the operating company's you know, balance sheet. And again, provided 5-year loans on interest only terms. Now, how I got to that LVR 47% was simply looking at applying a 3 times multiplier over the EBITDA of OpCo A and OpCo B. So collectively, they made $2 million in EBITDA, which is your earnings before interest, taxation, depreciation, one-off expenses. On a 3 times multiplier, that's a $6 million valuation. If we add into the mix the 6.3 mil value of the original property and the 5.5 mil purchase property, that's circa $17 million in assets versus an $8.2 million loan, which is where we got to that 47% number. Loan number 6 on the far right was purely a fit out loan to fit out the purchase property, PropCo B. So we did a $380,000 loan. That loan is purely secured by the operating business B. So we took a GSA over that business, a first ranking charge. And that loan being goodwill backed, we did a goodwill lend here, cash flow lend. We did a 10-year MWAP profile. So you can see for the first 12 months, we provided interest only to give the group time to, you know, fit out, renovate, and move premises. And then the 9 years was on principal plus interest. So we want the loan to be brought down to a 0 position over a 10-year horizon.
I think
so that's essentially
this one, Luca, you know, obviously this client had an incumbent bank and that bank wasn't able to get there. This one was a really good display of how we looked at things a little bit differently and were able to support a client to get there, moving from sort of leasehold to freehold, you know, providing that support to get a client into effectively 100% plus costs, as well as understanding the underlying value of their business, which we're really comfortable lending against, and then putting in the structures in place to get them the funds that they need in an effective way that's not going to stretch cash flow for them. And we were able to support that acquisition for them where the incumbent bank wasn't able to, from the way they viewed it from a servicing point of view and what have you. So I think that this one was a really good one. Effectively, we end up with someone who now has 2 owner-occupied sites where the incumbent bank wasn't able to support that.
Yeah, and to your point with serviceability, what we did was we used a lower buffer So a lot of banks use circa 3% buffers. We use a lot lower than that, being rated, SME, which essentially means that, the income that we are generating is reliant on the businesses. So that also provided an opportunity to lend them money where the other banks couldn't, because interest-only terms with a very low buffer. So that was also key to this mix, not only from the gearing point of view, but also from a serviceability perspective, and made it really work really well and healthy.
Which effectively then allows the client, they were also busting at the seams. So they move into a larger property, then adds value back into their business when they're fitted out to grow their business. So yeah, it was a definite win for them.
Right, next slide, please. So the second case study, two-site medical centre, again located in Sydney. We named it Medical X. A bit of background: Site A, the original site or original business, was established back in 2003 by the 5 original founding owners. A second business was acquired in 2015, where there were 2 remaining owners within the second site that stayed on within the group. And effectively, post that acquisition, there were 7 equal owners in the business, representing 14.9% stake evenly across the 7 of them. The group is managed and supported by a senior management team that have expertise across managing medical centres. Site A has 12 consult rooms, Site B has 8 consult rooms, and offer mixed billing and private billing, and also have some allied health services within the group. Now, with this transaction, we financed a total of $13,950,000 in loans across 12 loan facilities. And the main purpose of this loan was to facilitate succession planning. So what we did here was, there were 2 incoming shareholders and there were 2 exiting shareholders. And we facilitated that acquisition for the 2 incumbents, known as shareholder 7 and shareholder 6. And we also refinanced a number of loans from the original OpCo A and OpCo B. So the original 2 businesses were also refinanced across to Macquarie as part of the mix. And with the shareholders, we also bought across their homes as part of the mix, which I'll talk to you in some detail over the next slide. So before we get into some of the detail, the org structure, quite a straightforward one here. So there's 2 businesses that trade, OpCo A, OpCo B. All the profits flow into a holding entity, and the holding entity then disperses monies accordingly to the shareholders. And as I mentioned, if we divide 10 or 100 by 7, it equals to 14.29% shareholding across each individual stakeholder. Next slide, please. So with this table, again, we'll talk through it in some detail here. So loans 1 to 4 were purely refinances. So we refinanced OpCo A's and OpCo B's loans. In this mix here, it's a good little leverage. So again, we looked at the EBITDA of OpCo A and OpCo B. Collectively, they made $1.75 million. We applied approximately a 3 times multiplier, which essentially is a $5.25 million valuation. We took a first ranking charge over the 2 operating companies and also the holding entity, and we took limited guarantees by the 7 shareholders. So line number 5 and 6 were purely to facilitate the buy-in. So how this worked was, because the 2 shareholders were the group's 2 again largest billers and income generators, like with the first case study, the group wanted to lock these individuals into the group to sustain future income and just to also sustain future value in the business. So what they did is they sold their stake, or the stake of the exiting shareholders, at $4 in a dollar. Yeah, market is not that. Market is more around 6 times, but they discounted the purchase. So on a 4 times multiplier over a 1.75 mil EBITDA is a $7 million valuation. Divided by 14.29%, you get a little bit over $1 million in sort of buying requirements to acquire the shares in the business across shareholder 6 and 7. So the first loan of $400,000 was purely a goodwill loan against the 2 OpCos. So the loan, the debtor was the name of a discretionary trust, which had a corporate trustee, and the shareholder 6 was the director of that company. So we took a guarantee by the shareholder, and again, the security was a first ranking charge over the 3 businesses. Yeah, loan number 6 was, again, something that Macquarie does quite unique in market is we also provide an exertion loan facility. So what we did was we leveraged against the individual GP's billings. This individual shareholder made about $500,000 net billings, which was quite healthy, but we capped it at $250,000. So what we did was we did, again, a cash flow lens secured by the billings of that individual doctor. We took a GSA over the corporate trustee of the discretionary trust, which was where the billings flow into. And with all of our goodwill loans, as I touched on earlier, we do a 10-year repayment curve. So we require all these loans to be amortized down to 0 within a 10-year period. Next slide, please. So if I continue with the structure, how we got to the $13.9 million in loans, we also leveraged against the shareholders' home property. So we refinanced the home loan, we encumbered the property where they live. So the loan number 7 of $350.3K relates to an equity strip out of the property to, again, orchestrate the purchase of that $1 million requirement to buy into the practice. So being property backed, we did a 30-year loan term, interest only for the first 5 years. The security structure was a first ranking mortgage over the property. And we took also a personal guarantee by the shareholder 6 because the debtor was in the name of the discretionary trust. Loan number 8 is purely a home loan. So shareholder 6 and spouse refinance the home, a $4 million loan over 30 years P&I, simple. It's a simple home loan there over that 30-year period. The loans number 9, 10, 11, 12 almost essentially replicate, the loans, 6, 7, 8, and 9. So again, we did a $400K goodwill loan against shareholder 7. So we leveraged against the opcos A and B, and again took the corporate guarantees and the personal guarantee by the shareholders. Again, a 10-year loan horizon, and then if you move to loans 10, 11, and 12, again 10 was purely an exertion loan. This individual doctor made $450K in net billings, so a little bit lighter than the shareholder 6. However, we capped it at $250K, as I discussed earlier, a 5-year term over 10 years. And then loans 11 and 12, again, essentially an equity strip, released equity out of the home to complete the mill buy-in. Again, 30 years, 5 years IO. So what's really critical here is that we were able to leverage against a number of different assets, being 1, goodwill, number 2, exertion, and number 3, property. So we can be very, very smart in how we approach leverage for this group. And in terms of serviceability, again, we look at the individual billings of those doctors, and then we take a stake in the overall profits of the business to substantiate serviceability.
I think this very much touches on sort of that piece succession, right? It's very much it's topical. It's obviously locking in people who are key income drivers. To Arlene's point, income within a practice, keeping that consistent, growing it. Quite often, keeping your key income drivers engaged is really important. And something that we do every day of the week and we're really comfortable with is that succession piece and being able to use the business to support. I think this example very much highlights not only that willingness and ability and want to, look at the underlying value within the business, it's also the fact, again, thinking about it a little bit differently. So sort of having a meeting of the mind, seeing where we can support to really get maximum leverage across multiple different facets to get someone where they needed to be. And then, which is only good for the underlying business here because it's locking in your key income drivers and they're getting financial benefit from that too. So it's win-win.
100%. Next slide, please. So there's our contact details. So please reach out to myself and Caitlyn if there's any questions around structuring or if there's any opportunities to grow your practice. I'd love to have a discussion. Please reach out. We love meeting people and planting the seed around Macquarie healthcare and how we can help someone like yourselves who have a similar mindset to those 2 case studies in particular. Not sure if there's any questions, but love to, we've only got a few minutes left, but love to take some questions across the audience. If you think that you wants to be clarified or confirmed, happy to answer.
Luca, I might jump in while people are putting their questions in. Between the presentations, a common theme that came up was structure. Just maybe wanted to if someone could spend 30 seconds as to why structure is so important to get it right.
I'm happy to go first, and then Luca and Caitlyn can add to it. From my perspective and my area of specialty is really making sure that the structure is effective and efficient as you run the practice. But then also, as we talk about succession, you don't want to have a structure where it's so inflexible. Then when you start thinking about succession, whether it's bringing in another practitioner or you want to exit from the business, it's going to cost you a lot in taxes. That's one side of it. And then as you are running the practice, whether it's refinancing or financing, acquiring a property, again, it's all about making sure that the asset sits in the right entity, and the loan actually also sits in the right entity. Again, depending on what you want to do with it in the future, it fits with your strategy. So I think it's all in the one with what do you want to do with the practice? What are the future goals? And just make sure that the structure is the right one that can accommodate as many things as possible without it being cumbersome.
Yeah, to your point, Arlene, we're guided by the experts like yourselves, provide that advisory and expertise around structuring. So Macquarie Bank can really provide a loan in any structure, whether it be, in a family trust, whether it be in a unit trust, whether it be in an individual name or a company. You are the experts. Imagine, you have your own, delegates that you work with from a legal perspective to confirm what is the best structure from a tax perspective. From a bank point of view, we don't provide much advice around, the legalities, but what we can do is really structure a loan whichever way has been advised by the trusted advisors.
And I think it's useful to have someone who can actually, in a sense, look through those structures, because the structure might be there for a particular reason. But if people like you guys are actually looking at as, well, okay, well, what is the actual possible lend here? What is the serviceability when we look at everybody in the group, instead of, oh, is it going to be a company or is it a family trust, and just focus on that? And I think also the cash flow financing does help with a lot of medical practitioners.
Thank you, team, for that response. I'm just conscious of time, and there's no further questions have come through. Just wanted to say a big thank you to Arlene, Luca, and Caitlyn for your presentations this evening. And just to recap, what I took away from it was understand your key drivers in your practice, leverage off your data, get your structure right, secure financing that's tailored to your specific needs and from someone who actually understands your business and your other sort of personal structuring around that. And also make sure you get some funding built into any loan agreements that you get for the timeline before your capital outlay through to when your revenue starts increasing. So there's no point, shelling out a whole lot of money and then going, oh, I don't quite have the revenue to service it. So make sure that's also covered in that whole piece. So it's now bang on 7 o'clock, and we said we'll finish at 7 o'clock. So I just want to say thank you for everyone joining us this evening. We really appreciate you being here. Following this webinar, we will send out a quick survey just to get some feedback and also share our contact details with you. But once again, thank you very much for joining us on behalf of both RSM and Macquarie. Hope you had an enjoyable and informative session, and thank you very much.